Just sticking with that. So today we're gonna start off with skeletal anatomy, just about the basic bones in the body, the structures, the anatomy, and all of that. And then at the end we'll have a little Kahoot. Just 5 questions today, but for every week after this, I'm gonna basically have a 20-question Kahoot, basically kind of quizzing you guys on the lecture that we did the previous week. So, but based on what you guys learned today, you guys will have a lecture notes to review over the course of the week until next Friday. At the beginning of the session next Friday, we'll have a 20-question Kahoot going over everything. So make sure that you guys kind of have a grasp of it, inshallah. So let me just finish putting you guys' emails in, and then we'll get started. So I just want to ask you guys, like, what do you guys want to kind of get out of the class? What are you guys' expectations, and what's your guys' kind of approach to this class in general?
I'm taking anatomy next year in school, so I want to have like a basic understanding of it.
Okay.
Before school.
Is it college level or is it high school?
High school, I think. Okay. Yeah.
Have you had any background in anatomy yet, or not yet?
Not really. No.
Okay. That's fine. Anybody else want to share what their expectations are for the class?
I'm also taking anatomy next year at Green during high school. I'm taking high school level anatomy next year, so I just want to be prepared for next year.
Yeah, sounds good. Do you have any background in anatomy? Like, have you taken any class yet?
Nope, I've never taken an anatomy class.
And what do you guys want to do for the future? Like, what's your guys' career plans? First of all, thinking about it.
I also want to go to med school. So, yeah.
All right. Sounds good. So I'm about to just send the link right now. Just send the file right now. So let me know if you guys got it. All right, I think it just sent. Just let me know if you've got it. Is it there for you guys? All right. Person. Did you all get it?
I haven't got it yet.
I'm sorry, who said they didn't get it yet?
Me.
Oh, yeah. I think I just sent it to you, Shayma. All right, so once you guys all have it, I guess I'll start getting into lecture slides and start. And guys, feel free if at any point you guys are confused or you have any questions, just let me know immediately. Feel it's like open mic. Don't be shy or hesitate to ask any questions or anything you guys don't understand. All right. So with that said, I'm gonna get into the lecture. I hope everybody has it now. All right. So, all right. So we're gonna start with the skeletal system, and first thing we're gonna do is the introduction. And so this is basically the basic information about the skeleton in the human body. We have 206 bones in the adult human body. What's actually interesting is that when you're younger, when you're a baby, you actually have more bones. But as you grow older and become an adult, they begin to fuse. And then a typical adult male who doesn't have any bone deformities will have 206 bones in their body. And there's cartilage that kind of fuses the bones together so that you don't have constant friction between the bones rubbing together. Cartilage is placed in so that you're able to move flexibly and you don't have the constant grinding of the bones against each other. And the two things that are used that are in the body that connect bone to muscle and bone to bone are tendons and ligaments. And a good way to remember what each of them do, for example, for me, I see ligaments starts with an L and it connects like, bone to bone. So it connects like to like. And that's how you can remember that ligaments is bone to bone and tendons connect the muscle to the bone. And just the basic functions of the skeletal system, the body gives the body its framework, maintains its shape, protection of vital organs, provides a place for muscles and supporting structures to attach, mineral storage, blood cell formation, and it allows the muscles to act by forming kind of a lever system in which the muscles attach to your bones and then are able to contract and relax based on that. So what the basic composition of a bone is the osseous tissue, which is the tissue that makes up the bone. But at the same time, there's also blood, bone marrow, cartilage, adipose tissue, nervous tissue, and fibrous connective tissue, all present in the bone as well. Those are all inside the bone. Like for example, adipose tissue is what is known as fatty tissue, and nervous tissue is what kind of connects the different the neurons together. And you have fibrous connective tissue that just is inside the bone and it helps to mesh and keep everything together. And so that's it for the introduction. Do you have any questions? Or anybody want to make a comment or anything like that? You guys good?
Yes.
All right, moving on. So the skeletal system is basically divided into two major components. You have the axial skeleton and the appendicular skeleton. So the axial skeleton is basically the center framework. It starts from the skull and it goes down to the thorax and down to the ribs. And so there's 80 bones in the axial skeleton, and in the appendicular skeleton, there's 126, which then form, if you add the two up, you end up getting 206 total bones in the adult skeleton. So for those of you who are going to be taking anatomy classes, you're likely going to have to memorize how many bones are in each, like how many bones are in the ribs, how many bones are in the face, the cranial bones, and you might even have to memorize the specific ones. So for me personally, like I'm going to have you guys know these bones. Know that there's in the appendicular skeleton is the humerus, ulna, radius, carpals, metacarpals, phalanges, which are the bones. Which is the humerus is this bone right here. You have the ulna and the radius. And a good way to kind of remember which one is which, because it's kind of confusing, the radius is always towards the thumb. So you see this would be the radius and this would be the ulna. And then you have the carpals, which is the beginning of the fingers, the metacarpals, which is the middle, and the phalanges, which are the tips of the fingers. And you have the clavicle, which is up here, which is like your collarbone. You have the scapula, which is in the back area of where the arrow is right here. And then you have the pelvic girdle, which includes the hip, the pelvic, and this area here is called the coxal bone. And then you have the lower limbs, you have the femur, which is the big bone right here. You have the patella, which is your kneecap. And then you have the fibula and the tibia. And the tibia is the smaller one. That's a good way to remember. The tibia is smaller, the fibula is much larger. And then like you have the carpals, metacarpals, and phalanges, by your feet you have your tarsals, metatarsals, and phalanges. And that's basically the overview of the appendicular skeleton. So I do expect you guys to kind of go through this and know which bones are part of which skeleton, and I'll test that at the beginning of the session next week. And then if you move over to the exoskeleton, there's the cranium, which has 8 bones. And then you have the face, which has 14 bones. The hyoid bone is near your tongue. And then you have the auditory ossicles, which are part of your ears. And then the vertebral column, which is in the back, which makes up your spine, the spinal column. And the thorax, which includes the sternum, which is the one in your chest. And then the ribs, which are surrounding the sternum. And those are 24. And so eventually, when you guys get into more later stages of anatomy, you're going to have to know what are the 8 cranial bones, what are the 14 facial bones. But for now, we'll just kind of keep it simple. And so you guys just try to look over this diagram and know which bones are classified into which category. So this is just another kind of overview of what I already said: the cranium, face, the part of the skull. And then you have the hyoid bone, auditory ossicles, which are the ear, and the vertebral column in the back, and then the thorax, which includes the sternum, the chest, and then the ribs that are surrounding it. And here's the appendicular skeleton again, and the total is 126. Total bones in the adult, when you add the exoskeleton as well, is 206 bones. So you guys got it over there? And you guys know what to kind of study and what I want you guys to kind of get out of this part?
Do you want us to know the number of bones in each one too?
Some of them, yeah, if you just go over there, like you have a humerus, you have 2 on each side. Most of them are going to be 2 because you have it on each side. Mm-hmm. And I think that's good for you guys to know. I won't necessarily test it, but at the same time, it's not too difficult. Like carpals, metacarpals, phalanges, you have, for example, you have 5 fingers. You have 10 fingers, sorry. So you have 10 bones over there. And then the carpals, they're a bit different because it's like, because you're gonna have because you have there's differing amounts in each one. You guys don't have to get into details of that, but it's good to know. I won't necessarily test it, but I want you guys to at least know which bone belongs where, and also maybe identify the bones themselves. If I put a picture and ask which bone is this, you guys should be able to identify the bone, and then which part of the skeleton it is.
Okay.
And so now I want to get into the actual parts of the bone itself. So can anyone tell me what bone they think this is?
Is it the femur or the humerus?
One of them. Which one do you think?
I think humerus.
Yep. Perfect. That's the humerus. So, yep, it's the humerus bone right in your arm. And so we're just going to kind of get into the parts that make up the bone itself. So this is basically classified as a long bone, which is kind of self-explanatory. It's a long bone. It's along with the femur, humerus, they're the major long bones in the body. And the first main portion of the long bone is the diaphysis. And that's basically the shaft of the bone. It's the major part of the bone. Is what the bone is basically composed of, the middle part of the bone. And then at the ends, you have the proximal and distal epiphysis. And those are kind of the parts that are connected to the nearby bones, or connected to the cartilage that then connects those 2 bones together. So those are at the ends. And in between the diaphysis and the epiphyses, you have the metaphysis on both sides. And they're kind of the central, like the neutral region between the 2, where you transition from a smaller radius and you start getting into a bigger radius. So this is kind of the transition area, and these are what connect different bones together, and this is the major shaft of the bone. And here you have the epiphyseal line, and it's made of cartilage actually, and this is where, once again, where this part of the bone is going to start connecting to in this situation, it's going to start connecting to the shoulder. The humerus will start connecting to the clavicle and scapula back here, and it'll form a triad. And the epiphyseal line kind of represents the transition into the connection with the other bones. And inside the bone itself, you have the medullary cavity. So this area itself is called the medullary cavity, and it contains yellow bone marrow in adults. Does anybody know what yellow bone marrow is composed of? Anybody? So if not, it's actually made of adipose tissue or fatty tissue, and that kind of gives it that yellowish appearance. And that's why often when you think of fat in the body, you see pictures and it's yellow. And a lot of it is also because adipose tissue primarily makes up yellow bone marrow. So that's a good way to kind of remember that adipose tissue or fatty tissue is what is in the medullary cavity, and that is also part of yellow bone marrow. And then at the top of the bone, you have the spongy bone. And this contains the red bone marrow. And this is what makes the red blood cells in your body. And it's going to be on this part of the bone, of the long bone. And then the majority of these long bones is the compact bone. And that's what makes the bone rigid, hard, and very sturdy. So that's why, you have to have your bones strong. And that's why they say calcium is very important, because calcium is involved in the production of the compact bone to keep your bones healthy and strong. This kind of gives it the rigidity and the shape of the bone. And then for the coverings and the membranes, as I stated before, you have cartilage that kind of connects the bones with the other bones. For example, here on this part of the humerus would be connected to can someone tell me what these two bones would be connected to are? It would be the ulna and the radius, which are your forearms, which make up your forearms. And this side would be connected to the shoulder and the clavicle. And it's articular cartilage that does this. So there's different actually types of cartilage. There's hyaline cartilage and articular cartilage. And articular cartilage is the one that is involved in the connection of bones. But you guys don't have to know that in such a detail, but that's just a good point to know. And then within the medullary cavity, you have the endosteum. You have this covering here, and that basically lines the medullary cavity. So does anybody know what this red part going through the bone is? Anybody have any idea? It looks like what it is. If you guess, you're probably gonna get it right. Anyone? All right, it's a blood vessel. So of course you also have to have the blood supply going through the bones, and that goes through the medullary cavity all the way down, as you can see from here, goes all the way through the bone and supplies the bone with the necessary minerals that it needs to function and grow on a day-to-day basis. And then finally you have the periosteum, which covers the compact bone, once again giving it the rigid shape and the white kind of covering that we kind of think when we see bones. The white stuff covering the bone, that's a periosteum actually. All right, so now we're gonna get into different types of bones. We have long bones, short bones, flatboid, sesamoid bones, irregular bones. I'm gonna kind of go through this kind of fast. It's not as important for you guys to know. So just like the long bone is the femur. These are the typical characteristics of what a long bone would be. It would have the diaphysis, epiphysis, and the metaphysis as well, along with the medullary cavity. And these condyles, so this little structure here that you see that is involved in the connection of bones is also referred to as a condyle. So it's a good attribute to know. And then you have short bones which are in your feet and your hands, and they don't have a diaphysis. So they don't have that long shaft part of the bone. They're mostly made of condyles and a distal and a proximal epiphysis. And then you have the flat bones like the cranial bones, and you have the inner and outer surface tables, and in between it, you have what is called the diplo. That's the inner part of the bone, and it's referred to as the diplo, and it has primarily spongy bone. as you can even see, the shape is a little bit different. You see like the little holes that are in the in between this part and that part. Those are part of the spongy bone. And what does spongy bone have inside of it typically? Someone tell me. All right, it's got red bone marrow. Spongy bone is associated with red bone marrow typically, which produces red blood cells. And red blood cells, for those of you guys who haven't learned it yet, red blood cells are the ones that carry oxygen to your muscles and to the rest of your body, because they also carry hemoglobin. Have you guys learned about hemoglobin? And you guys learned about hemoglobin? The hemoglobin curve and oxygen saturation?
Mm-hmm.
So what can you tell me about hemoglobin? If you've learned it yet.
I've learned it, but I don't like remember it that much. But
Okay, no problem. So hemoglobin basically is an oxygen carrying molecule that is associated with red blood cells. It's like an iron-rich carrier. It's like it's an iron molecule. It has a heme core, which means that the core of it is iron molecule, and then it has 4 different areas where oxygen can bind, and oxygen binds to the hemoglobin, and the red blood cells, then they bind to that hemoglobin with the oxygen attached to it, and they go deliver it to the different parts of the body, to the muscles. And that's why it's really important, like if you're exercising and you're working out and your body requires a certain level of oxygen, you need the red blood cells and the hemoglobin to be carrying that oxygen in those kind of situations. And that's why people who have anemia, they have lack of red blood cells, and you'll see they'll be very like out of breath, they'll be very tired, and because of the lack of red blood cells, are not able to sufficiently carry oxygen to the tissues that need it. And that's why people who are, for example, sickle cell anemia, you guys probably have heard of that in the past. And that's where your red blood cells have an abnormal shape, like a sickle cell. So they can't function to their proper capacity. So what you're gonna have is, you're gonna have red blood cells that are not able to carry as much oxygen to your tissues. And then if your tissues don't get the required oxygen, they're not able to function properly. And this has a systemic effect on the body, and it can cause, like periods of intense pain and intense fatigue and those kind of symptoms. And so it's very important to kind of make sure you're getting enough iron in your diet, so you can have enough hemoglobin, and inshallah we'll all have healthy red blood cells, so we don't have to worry about anemia or anything like that. Okay, and then you have the sesamoid bones, like the patella. They're the very smooth bones. Like if you feel your kneecap, you'll feel it's very smooth. It's round. There's no protuberances or anything like that. So that's the quality of sesamoid bones. And then finally, you have the irregular bones, like the vertebrae, which make up your spine, and they just have this type of shape, and they're all connected to each other, and they make up your spinal column. So those are the bones by type. So any questions so far? I feel like I'm doing too much talking. You guys have anything you want to ask or comment about anything? Should I continue then?
yeah.
All right. Let me know if I'm talking too much, or if you guys, like, don't be shy to say anything. Don't worry. It's no biggie. All right, so I'll just continue. So we kind of talked a little bit about the osseous tissue, and that's basically the bone tissue. And so now we'll get into the bone cells that make up the osseous tissue, and how they all, there's like a linear pattern that kind of goes within these cells. So the first type of cells that originate are the osteogenic cells. So when you're young, you're gonna have a lot of osteogenic cells, and they're essentially stem cells, and from embryonic fibroblasts. So basically when you're still in the womb, you're having osteogenic cells being formed, they're stem cells, and then they eventually are gonna give rise to the next type of cells, which are the osteoblasts. So these are the cells that deposit bone. Basically, they produce bone and they deposit it where needed. So going back to the osteogenic cells, where they're located in the endosteum, which we touched on earlier, was in the medullary cavity. So here's like a 3D kind of image of the bone. And here you're going to have the central canal, which is part of the medullary cavity. And in there you have blood vessels, for example. And remember that I said the endosteum, it lines the medullary cavity. So the endosteum is here. And that's also where the stem cells, or basically the osteogenic cells, are located. And then you can also see like the different type of, the different structures of the bone, the osteon, which is like this circular area around the central canal, if you're looking down. And the osteon is made of the concentric lamellae, these bunch of circular structural bone patterns. And then the outside covering is, of course, the periosteum, which is part of making the compact bone solid and gives the white kind of color. So yeah, these osteogenic cells, they're going to differentiate into osteoblasts. And osteoblasts, these are the cells that make bone. So when you're growing, you have a bunch of osteogenic cells converting into osteoblasts, and then these osteoblasts are what are making the bone, what are producing the bone and depositing it to help your bones grow when you're getting older. And if, for example, if you have a fracture or something like that, then more osteogenic cells are converted into osteoblasts, which then undergo a process called bone remodeling. And basically what happens is some of the bone that is broken is taken away and new bone is formed. So whenever new bone is formed, it's primarily the osteoblasts that are playing that role in the formation of your new bone. And our bones are actually constantly undergoing renovation. Even when we're healthy, perfectly normal, they're constantly being broken down and being reformed. There's a constant process that's probably happening. It happens daily, but I think every 75 days it was that all the bones, like all the outer layers of your bones are replaced. So it's a very constant and common process that, we don't even realize is happening all the time. So yeah, the osteoblasts, they deposit bone where needed. And so they're just located along the bone, and they're what push this bone outwards. So the bone grows also like from a width standpoint and a lateral standpoint. The osteoblast will make bone which will push it forward, and will make bone that will push it outwards as well. And so for example, if you have a stress and a fracture, you're going to have rapid increase in the number of osteoblasts that then basically allow for the new bone to be created, make the new bone. And then you have osteocytes. So these ones are interesting. They're basically osteoblasts that have become trapped in the matrix they deposited. So essentially they deposit the bone, but then they have no place to kind of go. They're kind of just stuck there. And they end up becoming ingrained in the bone that they have just deposited. And they're kind of trapped in the matrix that they have just produced, essentially. And so those are called osteocytes. So if you see the process so far, we have osteogenic cells that give rise to osteoblasts. And osteoblasts, they actually trap themselves. They basically kind of screw themselves, and they end up becoming osteocytes. And so that's kind of what happens with that. And this is the structure of what an osteocyte will look like in the matrix that it has deposited. So then now here the osteocytes, they reside in tiny cavities called lacunae. So all these little circles you're seeing, they're lacunae, and in them are osteocytes. So osteocytes, all these little circles that you'll see, these are osteocytes residing in the lacunae. And so if you see a typical picture of a bone, you'll see that. So now you guys are able to recognize these are basically osteocytes, which were former osteoblasts that kind of trapped themselves. And the areas that they reside in are called lacunae. And the osteocytes, they're connected to each other by these canaliculi. So if you see there's little lines in between the lacunae, they have a circle here, and you have a line that connects it to the other circle. So these circles themselves are called lacunae, and what connects them is the canaliculi. So they're always connected within each other. So here's the canaliculi, and the lacunae are where the osteocytes reside. And now we have osteoclasts. These are the large cells that are involved in dissolving the bone, which is also known as bone resorption. So actually the production of bone is also referred to by physiologists as bone deposition. And the removal of bone is known as bone resorption. So osteoblasts, they're the ones that make the bone. I try to remember it by saying osteoblasts, they blast the bone into place. They form the bone. And osteoclasts are what remove the bone. And they're in a constant kind of equilibrium. Osteoclasts removing bone, osteoblasts putting more bone in. Osteoclasts removing bone, osteoblasts putting more in. And this is what is involved in bone remodeling. So if you break a bone, for example, you crack it into two places. What first is going to happen is that the osteoclasts are going to remove the bone that is broken, or remove the area that is fractured, and kind of remove that bone. And then the osteoblasts are then going to come and put the new bone in. And that's why it's important. A lot of people you'll see casts and stuff. And the reason for this is because they want the alignment to be straight. So the whole reason of a cast is, for example, the osteoblast is going to put the bone in, but the problem is where it's going to put the bone in. So the point of the cast is to make sure that the bones connect to each other and that there's not like a slant or there's not a misdirection of the bone, because you don't want, if you have a break, you don't want the bone to all of a sudden be forming this way. You want it to still be able to connect. And that's the point of a cast or a splinter or whatever that you have if you have a stress fracture, is they want the bone to be able to form properly and be able to connect with each other so that you don't have improper growth of your bones. And so just kind of reviewing the tissue cells, you have the osteocyte, which is inside the bone, which is trapped inside the bone that it deposited, and it just maintains the bone tissue. The osteoblast, which forms the bone matrix. The osteogenic cells, which were the stem cells that then gave rise to the osteoblast, and finally the osteoclasts, which resorb or remove bone. And here's kind of a histological representation of what you would see if you just took a sample culture, you put it in a microscope. You would see here the osteocytes, which are trapped inside the bone. And then you have the osteoblasts, which are on the outside, and they're forming the bone, which then becomes this bone. So all this bone here moving inwards is all through the osteoblasts. And here are the osteocytes trapped inside. Okay, so I'm seeing the time. And so going back here, here's calcified cartilage. And as you guys know, cartilage is important in the bones to connect different bones together and even parts of the bones within each other. And that's why it's so important to also have a proper balance of calcium in your diet and eating well, so that it helps maintain healthy bone structure. And as you can see here, the calcified cartilage has its own distinct shape. It's not necessarily like the osteocytes or the normal bone. It has its little white part you can see, and that's the calcium molecules in there. And here's another representation, and here's the osteoclast now. These are the cells that remove bone. They're much more densely packed, as you can see. Like here, the osteocytes, you see like maybe one nucleus. Here, there's 4 or 5 nucleuses all together. There's a bunch of osteoclasts because they work together to remove the bone. So they're all together combined, and that's how they're able to perform their function effectively. All right, any questions, guys? Anything you guys want to comment about? Just in general, it doesn't have to be specific up to what we learned. It can just be in general questions you guys have about the skeletal system, about the bone, about real life applications. Nothing? All right, just let me know for sure. Just don't hesitate. Yeah, just don't hesitate. All right, now if you get into the osseous tissue itself and what the tissue is made of instead of the bones, you see there's 1/3 of it is organic matter and 2/3 is inorganic matter. And can anybody tell me why you would think there's kind of a mixture of organic and inorganic matter, a combination of the two? And you guys have any idea, any thoughts about why that might be the way it's designed? Okay, well, we'll get into it. So in the next few slides, I'll kind of explain that. So the organic matter, it includes collagen and various protein carbohydrate complexes. And collagen is involved in protein structure. It's involved in your hair, for example. It provides it flexibility. And collagen actually has if you guys have learned about it, has a triple helix formation. And that allows it to be, it's very tight. It's like a rope. You take 3 ropes and you intertwine them all. And collagen has a very rigid, but also flexible structure. And so 1/3 of the bone is organic matter. And collagen is one of the primary components of that organic matter. And then the other 2/3 of the bone are inorganic. And the majority of the inorganic is a crystallized calcium phosphate salt known as hydroxyapatite. And that's one you guys will definitely learn if you guys take the skeletal system and anatomy. You will learn about hydroxyapatite, which is a primary component of the osseous tissue. It's 85% of the inorganic matter, and the inorganic matter, remember, represents 2/3 of the osseous tissue. And there's also 10% calcium carbonate and lesser amounts of other ions in the inorganic matter, which is part of the osseous tissue matrix. So as I asked at the beginning, I said why there might be a mix of organic and inorganic matter. Well, the reason is that we have bones and they're very flexible. I mean, they're very flexible. You can see you can move out your bones, you can do all of that. But at the same time, they're very rigid and strong. So that's what's so important and so beautiful about the design of our bones is that we have a balance of both. So we have the protein component, the collagen, allows the bone to have a degree of flexibility. You can move your bones easily, not much pain. It's like normal movement. At the same time, you have the inorganic matter, which gives it the strong rigidity. Like if you touch like your skull, you see how hard it is. And that's from the inorganic matter that makes it very strong, but at the same time, it's also flexible. And that's why that combination is so important, the composite of mineral and protein. And here is just showing an x-ray of what a fracture would look like. As you can see here, you have a severe crack in the, this is the, luckily the tibia, or the fibula. I think that's the fibula actually. So of the leg, and you can see, so can anybody kind of tell me what would happen within your bone cells after a fracture like this? Or what bone cells would play a major role in fixing this this stress fracture?
White blood cells?
Yes, white blood cells is one of them.
Would
Nice.
osteoblasts be one?
Osteoblasts, yep. And what's the one that works together with osteoblasts?
Osteoclasts.
Yeah, exactly. So those two would be the 2 major principles that will be involved in the fixing the stress fracture, but also white blood cells, as was mentioned. That's going to be involved in the immunology part, because you don't want any infections to start in an area like that. So there's going to definitely be the recruitment of white blood cells, such as macrophages and stuff in that region of the fracture. All right, finally, we're going to get into compact versus spongy bone. And I kind of touched briefly about it, but we're going to go more into detail here. So here's the long bone. What we discussed earlier was the humerus. This is another example, and this is just a different diagram, essentially showing the same thing. So on the outside, with the proximal epiphysis is, you have the spongy bone. And can someone remind me what is inside the spongy bone?
Bone marrow.
Yep. What color bone marrow?
Yellow.
Red, I think.
Red.
Red. Yep.
Red. Yeah.
And where is the yellow bone marrow? The diagram will help you out if you look at it.
The medullary cavity.
Perfect. Exactly. Perfect. That's the medullary cavity. Here you can see the yellow bone marrow. And remember that yellow bone marrow is also given its hue because of the adipose tissue, which is also known as fat. So that's also part of it. And so inside you have the medullary cavity, the periosteum, the articular cartilage, all that stuff we discussed already. And so sometimes you'll see words used interchangeably. And for example, the compact bone is also known as a cortical bone, which is the outside part. the hard part of the bone. And sorry, and then also for spongy bone, in medical terms, it's often referred to as the trabecular bone, and less often the cancellous bone. But mostly spongy bone is the kind of the layman's terms, the general word that we'll use for like with patients and stuff. But the medical term is actually the trabeculi, and it's what makes up the trabecular bone or the spongy bone. And so now if we're looking within the outer layer and the inner layer of a bone, for example, this is the cranial bone. And does anyone remember what the inner part of the bone was called, of a flat bone was called? It was called the diplo. And we covered it a bit earlier. That's not important, but so within the diplo, you have a combination of the compact bone and the spongy bone. And you see the hard parts, the inner bone, the diplo is formed of the spongy bone. The outer part, this part, and this part, this part and this part is the cortex or the compact bone. But the inner part of it is the spongy bone, which has the red bone marrow and whatnot. But the outside of the bones themselves are the cortex bone, which give the bone its hard, rigid structure. Okay. And so this is once again just the overview of the bone, but with emphasis on the trabeculi, which is where the red bone marrow is located. And you see it's part of the spongy bone. And the trabeculi is what makes up the spongy bone. Which spongy bone, as I said also earlier, the medical term is the trabecular bone, but there you can say either one. And the trabeculi is what are the components of the spongy bone itself. So here, if you go into a bit more detail, you have the bone marrow cavity, which is the medullary cavity, the periosteum on the outside, which is, the periosteum is what outlines the compact bone. Remember, the compact bone is the bone itself, and the periosteum is the covering of that compact bone. Just as the articular cartilage, which is this light blue shade right here, is the covering of the spongy bone. And within the spongy bone, you have the osteocytes, and see right here is the bone marrow, and surrounding it is the trabeculi. So the trabeculi and the bone marrow, they're all intertwined within the spongy bone. Any questions? You guys got it? Oh yeah, and here also the osteoblasts and osteoclasts that are involved in the reformation of the bones. All right. So the compact bone, this is kind of just a review. They're connected by canaliculi. There's a central canal, and there's concentric lamellae that go around each canal, and that's what forms an osteon. An osteon, so remember that an osteon is the basic structure of the compact bone. And an osteon, what it is, it includes the concentric lamellae and the central canal. So it's like the middle and what surrounds it. Yeah, like I said, a central canal and its lamellae constitute an osteon. And that's the basic structural unit of a compact bone. Yeah, an osteon is just a cylinder. So it's kind of just reviewing that there's no basically from a diagram, this would be the osteon. This part along with what is inside the central canal. And but the one thing that we should is important is there's a few areas where there's circumferential lamellae, and these are on the outer region of the bone, and these don't have a central canal with them. They're just kind of going around the outside, going around the boundary, and they're basically osteocytes that are connected by canaliculi, and they're just going to go around the bone, around the bone, around the bone. And they're not the actual component of the compact bone itself. They're just kind of the endings of the bone. All right, so just a quick little histological quiz for you guys. Can someone just tell me what any of these 1, 2, 3, 4 point to? What structures they point to? Come on, guys. I'm going to need one of you guys to say something. Anybody? Abhiyan, you've been kind of quiet. Hassan, you guys have any idea?
I'm not sure.
You have, what do you think number 4 is? Okay, if I go back here, what do you think number 4 would be? What do you think number 4 would be? Look at this, and then you see this. What do you think
Wait,
number 4?
can you go back to the previous picture one more time?
Yeah, sure.
Are they gonna be like the collagen fibers?
Well, what are the collagen fibers inside of? So collagen fibers are going down this circular structure, which would be the central canal. If you see what I'm trying to say. So here's the central canal, and the collagen fibers are kind of going through it along with the blood vessels and stuff like that. So that'd be a central canal. So maybe I'll ask you guys more next week when you guys kind of get to review the structures a little bit. I'm gonna kind of quickly wrap this up because there's a 5-question Kahoot we can get to really quick. I'll just, so spongy bone, basically the main takeaway is that it's permeated by bone marrow. And also, even though it's called spongy, and typically our connection with sponges is that they're very soft and squishy, the spongy bone is actually nothing like that. It's actually calcified and hard. It was just called a spongy bone because of its outward appearance, but not its actual physical characteristics. It's very much a bone. So it looks like a sponge, but these little parts themselves are very bony. And there's no central canals in a spongy bone. It's not formed as the same as a compact bone. And here are the trabeculae, which are involved to help with pressure and decrease the stress along the bone. All right, and here's just the histology, spongy bone, bone marrow. So if you guys want to go to med school, some of you guys, if that's your future aspirations, you guys are gonna unfortunately have to get used to looking at a lot of histological diagrams and seeing what's what, because when you guys end up having to interpret scans and stuff like that, that's what you guys are gonna have to be looking at. All right. So now, 1 second, just give me a second. I'm just gonna open up the Kahoots real quick. Okay. Can you guys all open Kahoot on your phones really quickly?
Yeah, 1 second.
I just need a second. Let me know when you guys are ready. Are you guys
Yeah, I'm
ready?
ready, but I can't see this.
I'm ready too.
Okay.
Oh my.
Let me just get the pen for you guys. You guys see the pen?
I don't think you shared your full screen, so
It's
I
still
No.
showing the lecture.
Can you guys see the pen?
No.
No, you can only see the PowerPoint. I think if you stop sharing your screen and then do it again, you'll be able to click the Kahoot screen.
Sorry, what did you say?
If you stop sharing your screen and then you do it again, then it will show your Kahoot screen.
Okay. Let's see. All right. Can you guys see it?
Yeah, that worked.
Yeah, Ben, are you coming through?
Nope, it's taking like a second to load. 1 second.
Yeah, no problem. All right, cool. Nice, nice. Let's see you guys. So, yep, so 206 bones are in the adult body. And just as a refresher, when you're younger, you can have more bones, but as you go older, they're going to fuse. All right, Nabi is in the lead. You guys remember the appendicular skeleton is the outside, like your arms, your legs, all that. The axial skeleton is what goes down the axis of your body, basically, from the skull down to your ribs and your spine. So the axial skeleton is more central, which includes the skull, and the appendicular skeleton is more the outside. Let's see. Shane is in the lead. All right. You guys remember the spongy bone is what has the red bone marrow. The medullary cavity has the yellow bone marrow, and the compact bone is just the hard part of the bone. So it doesn't have any bone marrow located in it. All right. So Shane is still in the lead. Osteoblasts. As remember, osteoblasts are what form the bone. Osteoclasts are what remove the bone. And osteogenic cells are what give rise to the osteoblasts. It's getting tight up top. Let's see who comes out with the victory. All right, last question. All right, guys, it was hydroxyapatite was the main one. Calcium carbonate was just to throw you guys off. Although there's calcified calcium in the bone, hydroxyapatite is what makes up 85% of the inorganic matter is hydroxyapatite. All right, let's see. Congrats, Shane. If you were in a real class, I'd have something to give you, but for now, I guess you get bragging rights. All right. So thank you guys all for tuning in. And you guys have any feedback or anything else you want me to improve, or any questions about what's to follow, or any clarification you guys want me to make?
Could you clarify what our homework should be?
Sorry?
Our homework. Can you clarify our homework?
I think you guys just kind of go through the PowerPoint and understand like the major points of it. Like, for example, the questions for next week's what do you call it? Kahoot will be very similar to this one. Like basically what the function of the four major cells are of the bone, like osteoblast, osteoclast, what are osteocytes, and the structures, like what's an osteon, and kind of be able to recognize, is this a compact bone? Is this a spongy bone? Is this a medullary cavity? And then the basic differences between know which bones are classified in the axial and the appendicular skeleton. It's kind of easy to remember. The axial skeleton just goes down the vertical axis and until the legs, and then the appendicular skeleton is what's on the outside and includes the legs and all that too as well. And just like the major kind of points I highlighted, so just go over the PowerPoint, the main slides, like the main takeaways from each slide, like that, yeah. And the questions will be pretty similar to the code questions today. Anybody else have any like feedback? Was I talking too much? Did you guys not understand the concept? Anything like that? Or you guys just want to get out of here? All right, I'll take that as you guys can't wait to leave. All right, it was good meeting you guys all, and inshallah I'll see you guys next Friday.
Thank
All right,
you.
assalamu alaikum.
Assalamualaikum.
Assalamu alaikum.
Thank you.